Bismillahirrahmanirrahim. Hello everybody. A 36-year-old woman gravid at 3 para 2 at 38 week of gestation come to the emergency department due to regular painful contraction. The contraction begins an hour ago, immediately after the patient had a gush of fluid. She has no vaginal bleeding and fetal movement has been normal. The patient's last prenatal visit was 6 weeks ago. She has no non-medical condition and does not use tobacco, alcohol, or illicit drug. Vital signs are normal. Fetal heart rate tracing show a baseline of 140 per minute with multiple acceleration and no deceleration. Contraction occur every 2 minutes on togodynamimeter. Pelvic examination show a cluster of clear vesicle with an erythematous base on the right labium. Speculum examination show a pool of clear fluid in the posterior vagina. The cervix is 6 cm dilated and 100% effaced with the fetal head at zero station. Which of the following is the best next step in management of this patient? Administer tocolytics, continue expectant management, initiate augmentation of labor, perform cesarean delivery, place fetal scalp electrode, start antiviral therapy. So first of all, this patient came to us in a stage of labor, active stage of labor at 38 week of gestation with the rupture of membrane. With the rupture of membrane. Second, she having on pelvic examination, she have a cluster of vesicle within erythematous base that is painful cluster of vesicle within erythematous base. So what is the diagnosis of question? Based on these hint, there is a cluster of vesicle within erythematous base that is painful. So this patient is suffering from active herpes simplex virus, HSV. So in patient with active herpes simplex virus, here we can perform the cesarean delivery because during the cesarean delivery, the chance of transmission is low, and during vaginal delivery, the chance of transmission is very much. So here the correct option is choice D, perform cesarean delivery. This patient has an active genital herpes simplex virus infection which typically present as painful vesicle on erythematous base that evolve into shallow open ulcer or erosion. Herpes simplex virus can be vertically transmitted transplacentally. The most common route of transmission is during vaginal delivery because the fetus is exposed to the herpes simplex virus during passage to the birth canal. Patient with active genital herpes simplex virus lesion, a delivery cannot undergo vaginal delivery and require an immediate cesarean delivery. Come to the incorrect one. Administer tocolytics. So a vertical herpes simplex virus transmission risk increase with the duration of membrane rupture. Therefore, tocolytic administration is not recommended. Choice B and C. I will explain choice B and C together. In contrast to this patient, individual who have a history of genital herpes simplex virus but have no prodromal symptom or active lesion at delivery can undergo vaginal delivery because maternal viral shedding and the risk of vertical transmission are minimal. Choice E. Place fetal scalp electrode. So fetal scalp electrode are avoided in patients with herpes simplex virus because they can cut the fetal skin and create a possible portal for herpes simplex virus. Choice F. Start antiviral therapy. So initiating antiviral therapy at delivery is unlikely to have an immediate effect on viral replication. Therefore, it is not indicated as it does not decrease the risk of neonatal herpes simplex virus infection. Come again to the choice D, where the choice D is the correct one because this patient come to us in active stage of labor with the rupture of membrane, and she having an active infection with herpes simplex virus because she having a speculum and pelvic examination. She having a cluster of clear vesicle within erythematous base on the right labium minora. So she having active stage of herpes simplex virus infection. A female with an active stage of herpes simplex virus infection, we will go toward the cesarean delivery because during the cesarean delivery the transmission is low. So that's why we can perform the cesarean delivery.